तेरी महफिल में ना आते तो दीवाने कहां जाते, अरे यहां भी बस्तियां होती तो वीराने कहां जाते. It is in that context, ladies and gentlemen, I am wanting to put it across. I am only putting 4 important parables to all this illustrious gathering for their consideration. Ladies and gentlemen, we are 1/6 of the population of the world. We have barely 0.28% of the total healthcare resources which are there in the world. And we have average 36.4% of the global disease burden to sustain too. And if I am permitted to say on behalf of all of you, one and the only one, the Dr. Sunil Gupta, Dr. Kavita Gupta, and their entire team, who are proud to adorn a genuine crown in the name of collectively being rubricated to type 3 diabetics. Esteemed resource persons, office bearers of the association, my esteemed senior colleagues, respected Dr. Suryavanshi, respected Dr. S.N. Deshmukh sir, respected Dr. Kalamkar, ladies and gentlemen, I have realistically no expertise in this arena to be in the galaxy of this eminence of medical experts. And perhaps the only qualification that I have at my disposal to be a part of the inaugural ceremony exclusively, quote unquote, is that I am a committed beneficiary as a type 2 diabetic of Hello Diabetic Academia, persistently and consistently for last 8 years in tandem and unison. Therefore, perhaps I am one person who is standing before you to be putting across as a beneficiary myself. And it is in that context I am tempted to say that the only thing I would like to put across is कि तेरी महफिल में ना आते तो दीवाने कहां जाते, तेरी महफिल में ना आते तो दीवाने कहां जाते, अरे यहां भी बस्तियां होती तो वीराने कहां जाते. It is in that context, ladies and gentlemen, I am wanting to put it across. I am only putting 4 important parables to all this illustrious gathering for their consideration. Ladies and gentlemen, we are 1/6 of the population of the world. We have barely 0.28% of the total healthcare resources which are there in the world. And we have average 36.4% of the global disease burden to sustain too. I am wanting to bring to your knowledge the paradoxes that plague all of us as a country. 6% of the population, less than 0.2% of the resources, and nearly 1/3 of the global disease burden. And this burden is not monotype in character. It is double disease burden, of which both communicable disease burden and lifestyle disorder burden is near equal in terms of its operation. That's the paradigm number 1 which I'm wanting to put across to all of you. The second important paradigm, in total tandem with the first proposition that I have put across, not only in terms of the availability of resources, but in terms of the ongoing economic contours to which any country is required to be looked at from the point of view of tackling the disease burden put on its head, is 1. What is the per capita income of that particular country and society? 2. What is the GDP of that particular country and society? And number 3, what is the out-of-pocket expenses that are required to be borne by the citizens of that country on the healthcare services? Having put across to you parable number 1, I am putting on to you on parable number 2. 2019 International Monetary Fund survey says that we are ranking 143rd in terms of the per capita income in an array of 193 nations. That's context number one. Our economy, our expenditure on public health in terms of the total GDP, which ought to have been 6% in terms of the recommendations right from the year 1942. Let me put it across, ladies and gentlemen, not from any political hue, shade or color, but from 1952 till this date, 5-year plans in terms of allocation, pick up any, the approximation of the financial appropriation for the healthcare in this country has never crossed 2.86% of the total GDP, which is not even 50% of what is recommended in 1952. As across this, a country which is ranking 142nd or 143rd in terms of per capita income, a country which is only 6% of the global population, a country which has got only 0.28% of the global healthcare resources, a country which is expected to be sharing nearly 34.86% of the global disease burden. In that country, the out-of-pocket expenses which are required to be borne by every citizen of this country as computed in 2018, after that the figures are not available in public domain, is 78.86% of the expenditure is out-of-pocket expenditure of the people of this country. It is in this context, ladies and gentlemen, I am wanting you and me to appreciate the role and relevance that academia, Hello Diabetes 2022 and initiatives like this are expected to be playing in this contrast situation. I am bringing you out to a second significant reality, which is now a matter of discussion in the study force, in the task force which has been constituted by WHO. Is it not a fact, ladies and gentlemen, that the pandemic of COVID has brought the entire world to this revelation, that the emphasis which the world economy and the world prosperity was putting across in terms of the healthcare services absolutely on curative domain, has it not revealed the chinks in the armory which stand created in last 50 years of the self-propagated development across the world? There does not need any further proof to bring to the human community to this realization that overemphasis on the curative domain has been one of the weakest links in the entire healthcare paradigm profile that the world had contemplated. The best and the best, significantly speaking, better than the best economies of the world, in terms of absolute pinnacles of curative domain, the entire situation absolutely fell down like a pack of cards to which you and me are a witness. Therefore, where lies the message, ladies and gentlemen? The message lies invariably in that the healthcare profile domain has to be absolutely based primarily on preventive and promotive domain alone, which is expected to be the way forward for the world for a genuine extension of health as a human right to all its global citizens. It is in that context a journey of 1,000 miles is expected to be beginning with humble step. I trust and believe, and this is my ardent belief, therefore I am saying this as a beneficiary of this entire proposition, as rightly put in by Dr. Sashank. It's not just an absence from the infirmity or disease which is expected to be a matter of health. It's a positive state. It's a sense of positive health. That positive health is expected to be plagued and dominated by a pursuit of happiness, which is expected to be not only a ceremonial affair, but which is expected to be every moment of dispensation. That ought to be what is called as the legitimate expectation to which every global citizen is entitled to. How exactly that is to be possible? How exactly that is to be worked out? How that doctrine of legitimacy of expectation is expected to be fulfilled. And therefore, in that context, I am expected to remind that when we formulated our constitution, we categorically said that the guarantee of right to health, which is incorporated in Article 21 of the Constitution of India, will be the responsibility of the state, and state as defined in Article 12 to be the appropriate government, be it the center and state. over a period of time. You take the developmental profile in the domain of the public health, not only in terms of the budgetary approximation, but if you take the figures of 2020 in terms of segregation between public healthcare delivery system and private healthcare delivery system, ladies and gentlemen, 2020 statistics brought out by Ministry of Health and Family Welfare categorically has brought out that in the entire spectrum, 81.64% of the healthcare is in private hands, and it is only remaining percentage which is less than 20% or which has now reduced down to 18% is in public sector. The dwindling healthcare delivery system in the public care sector over a period of time in continuous matter of routinity definitely is a matter of concern. And that concern needs to be dispensed by whom? Where we realize that the state, which was expected to be the constitutional authority for dispensation of this mandate, perhaps for its own reasons, is inadequate. There is a need for complementary state to be generated, which could be covered and rubricated under Article 12 of the Constitution of India. And therefore, ladies and gentlemen, I am tempted to declare initiatives like Academia, Hello Diabetes Academia 2022, and the ventures and commitment which have been put across by people plagued by passion like Dr. Sunil Gupta and his entire team is not just a small effort, but they turn out to be a complementary state covered under Article 12 of the Constitution of India. And it is in that context, ladies and gentlemen, I am not here to eulogize my words of appreciation for them. It was in that context I said, Teri mehfil mein na aate to. I am happy, I am proud, and I take it my greatest privilege that I have had the fortune of being associated with Dr. Sunil Gupta and this initiative, if not in any form, at least in the ceremonial inauguration form, continuously, unabatedly, and I take that as a part of my commitment, not with invitation, even without invitation, I will be here because I know it for certain. इस अंजुमन में आपकी आना है बार बार, इस अंजुमन में आपकी आना है बार बार, दीवारे दर को गौर से पहचान लीजिए. मैं पहचान, अदब और अदावत के साथ कह रहा हूं. तेरे नक्शे कदम के निशानों के तहत सरजमी ने अपने आप को सौभाग्य के साथ जो रचाया है, खुदा कसम तेरे जहन में इसी ईमानदारी को बसाया है. निश्चित तौर पर it is in that context, Dr. Sunil, Dr. Kavita and your entire team, I am not here for a formal inauguration. मैं आपका अभिनंदन करने के लिए नहीं आया. मुझ जैसे बेनिफिशियरीज की ओर से मैं आपका अभिवादन करने के लिए आया हूं. मैं उद्घाटन के लिए नहीं, अभिवादन के लिए आया. मेरा ये अभिवादन आप स्वीकार करें, यही आपकी स्वीकृति मेरी पावती है. इसी धन्यवाद के साथ, इसी अदब के साथ, thanking all of you ladies and gentlemen for your participation, for your participative presence and putting this across in such an elegant manner. Absolutely, I as a part of the host team would like to record my sense and gratitude to all of you. Thank you very much for making this particular event a real success, not only a success, but a milestone, a touchstone, and a gemstone in its own right. Thank you very much.
Nation Next, News Hub for New India.